How well did you do on the previous cardiac exam? All right, here are 10 more to keep you going. Number 1, a client with a history of hypertension presents with dissecting aortic aneurysm. Which symptom would the nurse expect to see? A, gradual onset of chest pain. B, sharp tearing, severe chest pain. C, bradycardia. Or D, decreased urine output. Number 2, a client with atrial fibrillation is started on dilatism. What is the therapeutic goal of this medication? Is it A, to convert your heart to a sinus rhythm? Is it B, to lower the blood pressure only? C, slow ventricular rate? Or D, increase cardiac output? Number 3, which physical exam finding is most concerning in a client with infective endocarditis? Is it A, splinter hemorrhage under fingernails? B, a new onset of heart murmur? C, a low-grade fever? Or D, fatigue and weakness? And number 4, a patient with a mechanical mitral valve is being discharged. Which statement indicates correct understanding of the discharge teaching? Is it A, I will stop taking my warfarin if I bruise easily? B, I need frequent blood tests to check my INR? C, I should take aspirin instead of warfarin? Or D, I don't need antibiotics before dental work? Number 5, a nurse is interpreting a patient's telemetry and sees a regular rhythm with a heart rate of 150 beats per minute. But they have a narrow QRS complex and no visible P waves. What is the most likely rhythm here? Is it A, ventricular tachycardia? B, atrial fibrillation? C, supraventricular tachycardia, also known as SVT? Or D, sinus tachycardia? Number 6, what is the expected action of amiodarone? A, lowers blood pressure. B, treats bradycardia. C, converts atrial fibrillation. D, increases contractility. Number 7, what is the nurse's first action when a patient has chest pain and ST elevation? Is it A, administer nitroglycerin? B, apply oxygen? C, notify provider? Or D, get a stat troponin level? Number 8, which symptom is most specific to right-sided heart failure? A, crackles. B, orthopnea. C, jugular vein distension. Or D, S3 heart sound. Number 9, what does a widened QRS complex indicate? A, atrial fibrillation. B, ventricular conduction delay. C, normal sinus rhythm. Or D, hypocalcemia. And last one, which drug is contraindicated in a patient with bradycardia and second-degree heart block? Is it A, lisinopril? B, furosemide? C, metoprolol? Thought I learned how to say it. I was going to impress you guys. Metoprolol. Or D, atorvastatin? So the answers, let's see how you did. Number 1, it is B, a sharp tearing, severe chest pain. So a dissecting aneurysm, it typically causes severe, sharp, acute pain. And it's a medical emergency. Very, very, very serious. Number 2, the answer is C, slow ventricular rate. So dilatism is a calcium channel blocker, and it's commonly used to treat AFib, and it helps control the ventricular rate. It doesn't really convert the rhythm, it controls it. Number 3, which physical exam finding is most concerning in a client with infective endocarditis? The answer is B, a new onset of a heart murmur. And this is because it suggests worsening valvular damage, possibly from vegetations along the vessels. And this can indicate progression of the endocarditis, which is inflammation and infection in your heart. And it may require surgery. Let's see, number 4, where am I? Number 4, the answer is B. So which statement indicates correct understanding of the discharge teaching? It's I need frequent blood tests to check my INR. And this is because mechanical valves require lifelong anticoagulation. So they will always be on a blood thinner. So frequent INR needs to be, and that's a clotting factor, or it indicates and shows your clotting time, needs to be monitored and is essential to reduce the risk of thromboembolism or bleeding. Number 5. So a nurse is interpreting the telemetry of a patient with narrow QRS complex, no visible P wave. What is the most likely rhythm? The answer is C, supraventricular tachycardia, SVT. This is because SVT is a narrow complex tachycardia with a regular rhythm and often hidden P waves. But why? Because it is due to the rapid atrial depolarization, and it's a sudden onset. So with AFib, you usually won't see a P wave either. So I think a lot of you guys probably said AFib. Here, there is a P wave. You just can't see it because the patient's having tachycardia. It's just happening. Their rate is so rapid. It's like it's kind of getting pushed back. Number 6. What was the expected action of amiodarone? It is an antiarrhythmic, and its action is to convert an atrial fibrillation arrhythmia into a normal rhythm, and also treats ventricular dysrhythmias. Number 7, the first line of action when a patient has chest pain and ST elevation is nitroglycerin, because it helps relieve ischemic chest pain by dilating coronary arteries. So it's a fast frontline treatment to get everything open and flowing. Number 8, which symptom is most specific to right-sided heart failure? JVD. It is jugular vein distension. Remember that for your test questions, because that is a very popular one. So right-sided heart failure leads to systemic fluid overload, and your whole vascular system on the right side will get congested, backing up, and you'll see that physically on a patient on the right side. Their jugular vein will be distended. You'll also see like peripheral edema, their body. So think of left-sided heart failure, left lung, your lungs, you get pulmonary edema with left-sided heart failure. Right-sided heart failure is JVD. All right, number 9, what does a widened QRS complex indicate? The answer is a ventricular conduction relay. Now I'm going to have to look at this one to give you guys this answer. So a QRS duration of over 0.12 seconds suggests a delay or block in ventricular conduction, such as a bundled branch block, say that 5 times fast, or ventricular rhythms. Okay. Number 10, which drug is contraindicated in a patient with bradycardia and second-degree heart block? The answer is metoprolol. So metoprolol is a beta blocker. We discussed that before, right? So it slows the heart rate, but it can worsen a heart block. It is contraindicated with people who have bradycardia, which means your heart rate is less than normal, less than 60 beats per minute, and heart blocks without a pacemaker. Do not give that beta blocker. All right, how'd you guys do? Let me know.